The biggest opportunity for staff is the future. And I think the challenge for managers, and indeed the challenge for boards, is to start the process of talking to the new clusters about the quality of the staff that they've got and about where those staff can be better placed in the future of future clusters.
I think you should be really confident that you can make the most of the situation that we're in. I think you should be very confident that you can make the changes which will improve services for our patients. I think you should be very confident that we can make the changes which will support our staff through those very difficult periods. And I'm looking forward to working you to making that a reality.
A lot of uncertainty around in the NHS at the moment. So it's a real opportunity for staff to take ownership, to take leadership, and especially those staff that are coming in fresh with a fresh pair of eyes. It's a really good opportunity for them to shape the future and I guess rewrite the sort of rule book as well.
Re-engineering roles, getting the right people doing the right kind of things at the right time in the right place, for example, is going to be crucially important.
Focusing on the patient experience and making sure we set ourselves the task of how do you make it better and cheaper. The more that we engage with communities, the more that they will help point to those things that matter and also those things where there's a real priority.
So it doesn't matter whether you're on the reception at a hospital or you're cleaning the room or you are a doctor or a nurse or whatever. I think you want to treat people as you get treated yourself, and if you can do that and just how you communicate with people, then that's what patient care is all about for me.
So I see this as a chance for all the different professionals within the health service to work together and focus on the patient.
Making sure that the right decisions are made with the patient, not for the patient, with the patient.
We want to make sure that what we're designing for the future and our thoughts for the future are going to meet the needs of NHS employers.
The best quality services, the most efficient services, the services developed by the best people in the best ways will probably be safer, will provide a better experience for patients, probably will have better outcomes and actually will be cheaper. And that's our real challenge, and I think that's what we'll be forced to do, and it is achievable.
There's still a great deal to do to improve patient care in terms of pain control, how staff talk to the patients, and making care very much more systematic than it often is. It should actually not just improve patients' experience but generate some real efficiency savings. And there's nothing really in the reforms or in the efficiency programme that will deliver that. This is down to frontline high quality leadership.
I think that one of the things that we can stop doing is just being in awe all the time of the private sector. I think there's lessons we can learn there, but I think that we can also demonstrate that we could be the generation that it could be this time round that people in the private sector look back and say that's how you handle change.